8:13 now on this Thursday morning. Somebody texted in two separate breakdowns in the HOV lane going from West Bank to downtown. That can get you depressed if you're sitting in that traffic. Taking care of mental health is vital. It's like taking care of our physical health, but as Dr. B is going to tell us, it can be difficult to share how we feel. Dr. Brent Wallis, Chief Medical Officer of People's Health, talk about depression and why it's so important to be honest about your mental health. Morning, Dr. B. How you doing?
Hey, good morning, Tommy. I'm good. How about you?
I wish we were back at People's Health having donuts and coffee.
I know, that was fun.
It was. Let's talk about mental health. What is that?
Yeah, sure. So mental health really includes a couple of things. It includes our emotional, our psychological, and even our social well-being. So what that means is that it affects the way that we feel or think or act, and really determines how we handle stress and how we relate to other people and make those healthy choices for ourselves. And keep in mind that your mental health can change over time, but it's going to be important really at every stage in life, from childhood all the way, through advanced age.
What is depression? How do you define that?
Yeah, depression is really a serious mental health condition, and it's more than just feeling sad. Everybody feels sad. They experience sadness. It can be a normal reaction to, any sort of loss or a disappointment or some sort of difficult situation you're in. And it's really just a normal part of being human. But if those feelings are really severe and they don't get better with time, then that could be a sign of depression.
What are some of the symptoms? I'm asking you this. I've been candid on the air, Doc. I've spoken about it. I suffer with depression. A lot of creative types do, and I don't take any shame in that. I'm not embarrassed about it. If I can help somebody by talking about it, I'm more than happy to do that. But for people that don't know, or maybe they're suffering and are not aware of it, what are some of the symptoms of depression?
Yeah, I mean, it looks different for everyone, but there are some common things that we see that kind of point towards depression, especially if they happen really often or if they persist for a long period of time, several weeks or months even. Obviously, feeling sad is one of the biggest one we see, but also people that have a lot of anxiety or maybe empty feelings. One kind of hallmark is something we call anhedonia, which is a loss of interest in things that you really used to enjoy. That's definitely a warning sign. And then sleep disturbances are really common as well. Some people have trouble falling asleep. Some people sleep too much. The same is true with eating. Some people may eat too much or really have no appetite at all and don't want to eat. And then definitely if you're having any thoughts of harming yourself, any thoughts of suicide or death, that can be important to really talk to somebody about. So if you have any of those feelings, schedule an appointment with your doctor. They can definitely talk this through. It's not always easy to talk about your mental health, like you were just saying, but we want to help you feel better. You need to be honest with us about your symptoms. That's really the first step.
And we're going to talk about some depression myths here. I just mentioned it, but I don't think it's anything to be ashamed of at all.
No, absolutely not. And that's something really important to take away from this. Deciding to get treatment for any condition, be it physical or emotional, is really a sign of strength. You're not going to feel bad about talking to your doctor about high blood pressure. You shouldn't feel bad about talking to them about feeling overwhelmed and possibly depressed. So a lot of people, unfortunately, think that they should be able to control their mental health on their own and that talking to a professional isn't necessary. But it's really not true. Counselors and psychologists and psychiatrists, and a lot of even just primary care physicians can specialize in these types of problems. They can sometimes be very complex, but they can help you figure out your symptoms and then recommend the right tools that you can use and possibly treatment to get better.
Is depression uncommon?
Absolutely not. Like you were just saying, there's a lot of stigma around depression, so it's probably under-recognized, but it's actually fairly common. And the CDC actually estimates that about 1 in 6 American adults will have depression at some point in their lifetime, so it's very, very common.
Does depression just go away without treatment? Can you just, happy your way out of this?
No, you really can't. It rarely goes away by itself, and if you don't get treated, it actually may escalate. It could actually get worse over time.
The way I explained it to somebody is like they say, well, just happy up, just this, just get yourself out of the hole. But sometimes the hole gets so deep, you can't get out of it. You can't even. Go ahead.
Yeah, no, exactly, Tommy. I mean, and like I was just saying, medical conditions you wouldn't just try to treat on your own in most cases, and it's exactly the same with mental health conditions. A lot of times you need to access care from a professional in order to really diagnose what's going on, find the cause of why you're having the feelings you are, and then coming up with a treatment plan and a solution to make you feel better.
Does it always have a clear cause? I'm a little bit confused about that.
Yeah, no, it really doesn't. Sometimes depression can be clearly connected to something. It may be if you've been diagnosed with, a long-lasting medical condition or cancer, if you've lost a loved one, that's a very common reason to have what we call reactive depression. But depression's not always situational like that. Some people may actually just feel depressed and they don't have any clue why. And it doesn't mean that their feelings are any less real. It's still important to talk to somebody, find out what that cause is, if there is one, and then seek treatment as well.
We're going to talk about treatment when we come back. We're talking to Dr. Brent Wallis, Chief Medical Officer of People's Health, about taking care of our mental health and how vital it is, just like taking care of our physical health. And as I talk about me struggling with depression, somebody texts in and tries to make fun of me, and that doesn't hurt my feelings. If whoever texted this in thinks that's going to hurt my feelings, you have no idea how this is like a piece of paper and a paper airplane hitting King Kong. That's what it's like. So I hope you feel better about yourself. You didn't hurt my feelings. I hope you stop texting and open your ears a little bit to listen about depression. Somebody texted in and said a lot of people dismiss you when you mention you have depression. They say, oh, well, everybody's depressed. Well, that's not the case, and we'll talk about it more with Dr. B when we come back, specifically drilling down on how depression is treated. It's 8:20, time for traffic now on WWL. 8:26 and a half, Tommy Tucker, WWL, back with Dr. Brent Wallis, Dr. B, our friend, Chief Medical Officer of People's Health, talking about taking care of our mental health, just like we do our physical health. We're talking about depression today. Doctor, how is depression treated?
Yeah, there's really two mainstays of treatment, Tommy. There's antidepressant medications and counseling. And the medications are really amazing. They've really advanced a lot over the last 20 or 30 years. And what they do is they help you feel a little bit better. They help kind of curb those feelings of sadness and hopelessness, and a lot of those other depression symptoms. But keep in mind that it's not just take a pill and you feel great the next day. It can take some time. In fact, often several weeks or even a couple of months on the medications, and you may have to try a couple of different ones to feel better in the long run, so stick to it for sure. And then counseling is really important as well, talking to a mental health professional about your emotional well-being and expressing your feelings and finding a way really to cope with what is going on can be very helpful. But make sure that you choose a provider or a counselor that you really trust and you feel comfortable with, because you want to stick with it.
What else can you do to improve depression symptoms?
Yeah, I mean, one of the most simple things you can do is actually be around people that you love. Being alone can actually make feelings of depression worse. So you want to do activities that actually get you involved and help improve your mood. So, volunteering is very important. Getting out into the community and helping others can make you feel better. Joining a club, like a book club or something, can be very helpful. And then definitely use the local councils on aging. They have a lot of activities that can actually bring people together.
What about other things like in your everyday lifestyle, some of the choices you make?
Yeah, I mean, like we say with regular physical health as well, staying active is critical. And over, all the studies have pointed to exercise as a way to reduce stress and anxiety and a lot of these feelings of depression as well. And you want that physical activity to really be a part of your regular routine. You want to shoot for about 30 minutes a day, 5 times a week, and you'll feel a lot better. And then food actually plays a big role, just like it does with other problems. Healthy food is going to give you a healthy body and a healthy mind. things like whole grains, fruits, and vegetables, you're going to feel a lot better than if you eat a lot of those fatty foods. And then the last piece is really sleep. Sleep is critical. When you have a great night of sleep, you wake up feeling refreshed and much better. So you want to really try to have good sleep habits and try to get at least 7 to 8 hours of sleep per night.
If somebody's listening and they feel as though they're in a crisis, what can they do?
Yeah, fortunately, we now have a crisis line that's available to everybody. You can call or text 988 for any crisis support, and that's available 24/7. That's really important, especially if you're having any of those thoughts of harming yourself. So use it if you need it, absolutely.
Good information. Thank you, Dr. B. Dr. Brent Wallis, Chief Medical Officer of People's Health. Have a great weekend. You can meet with one of the People's Health representatives in person at the People's Health Medicare Center. We were there Tuesday. It's at the intersection of Vets and North Causeway next to Party City. It's 3017 Vets if you want to look it up. Appointments are recommended, but walk-ins are welcome. They're also hosting in-person benefits presentation across Louisiana from now through December. You can find a presentation near you at peopleshealth.com/meetings. You can also follow them on Facebook and just Google peopleshealth.com. Open enrollment period for Medicaid is underway, and they will help you sort through the process. When we come back, we'll talk about tonight's Saints game.